right, Dorothy, next we're going to assess your ear. First, I'm going to have you do the Romberg test. So I'll have you stand up straight with your feet together. And then I want you to put your arms, cross your arms on your shoulders like this. And just stand there. So now what I'll have you do, Dorothy, is go ahead and close your eyes and just stand straight. And we'll do this for about 20 seconds. Okay, you're good. You can take a seat. So you didn't have any swaying or anything like that. If you were to have some swaying, that might indicate some vestibular problems, but you seem okay. Next, I'll just take a look at your ears here. They seem to be nice and symmetrical. I'm also going to palpate here and just feel. I'm looking for any lesions or any issues. But, oh, they're fine. The next thing I'm going to do is I want to take a look at your outer ear. So I'm going to use my otoscope here. And I'm just looking for any cerumen or any redness or exudate or anything like that. It looks good. You see it? Okay. The next thing is I'm going to look inside your ear, and I want to take a look at your tympanic membrane. In your right ear, I'm going to look in the 5 o'clock region. And it looks nice and pearly white. There's no perforations or issues. And then we'll take a look and nice and shiny. No issues in it as well. Next, I'm going to do the Romberg test. So what I'll do is I'm going to, this tuning fork is going to make a noise. So I'm going to put it next to your ear, and then you tell me when you don't hear the noise anymore. Still hear it? No. Tell me when you don't hear it anymore. Okay. We'll do the same thing on the other side. Let me know when you can't hear it. Oh, one more. So, and then next we're going to do the Weber test. So, I'm going to, are you able to hear that in both ears? Can you hear it equally in both ears?
No.
Okay, that's good. So that it completes my ear portion of the physical testing. Alright, so Dorothy, next I'm going to assess your nervous system. Firstly, I want to test the sensation on your face and from your forehead down to your jaw. So, I'm going to have you close your eyes, okay? And I want you to say yes. Every time you can feel something touch you, I want you to say yes.
Yes. Yes. Yes. Yes.
Very good. Now I'm going to do the same thing, but I want you to tell me if the object that you're feeling, if it feels soft or if it feels sharp.
Sharp. Oh. Oh. Sharp. Oh.
No, Mary. So the next thing I want to do is assess your trigeminal nerve. So I'm going to have you do some facial expressions for me. So wriggle your forehead, frown, smile. Can you puff up your cheeks? Okay, very good, thank you. Next, I want to just assess your eyelids and your resistance here. So I'm going to have you close your eyes just as tight as you possibly can. I'm going to try to open them. Okay, very good, thank you. The next thing I'm going to have you do is clench your teeth really tight. Clench your teeth. I'm just palpating your muscles here. Okay, now go ahead and open your mouth. Open and close your jaw. Okay, wonderful, very good, thank you. Next thing I'm going to do is look at your tongue. So have you stick out your tongue, go ah. Lift up your tongue up and down. Up and down, side to side. Okay, now I'm going to have you put your tongue in your cheek and push it as hard as you can like this. And I'm just going to, now do the other side. Okay, very good, thank you. The next thing I have to do is I have to test your gag reflex. So if you open up your mouth and go ah, okay, you have a good gag reflex. Shrug your shoulders like this. Okay, you can relax them. Next thing is I'm going to test your patellar reflex here. So just kind of let your legs hang loose, real relaxed, okay? There we go. All right. The next thing I'm going to assess is your Kernick sign and your Burdinsky. And this assesses to see if there's any inflammation in your meninges or any issues there. So they have you lay flat on your back. Legs straight. And then I'm just going to lift up one of your legs here. And then what I want you to do is I want you to tell me whenever you're having any pain, and when you're having pain, I'll stop. So I'm going to have you bend your knee a little bit here. There you go. Having any pain? All right, wonderful. You can relax your leg. And then we'll do the Burdinsky, and I'm going to have you just lift your head up slightly. Okay, very good, thank you. And you can go ahead and sit up. So, if you were to have any issues in your meninges and the Burdinsky sign, you would have automatically lifted your legs up because you would have had some pain there. So, but everything looks good. That completes my nervous system assessment for this portion. So I think next I'm going to assess your cardiac or your cardiovascular system. The first thing I'm going to do is just kind of assess you and look for any edema, specifically any dependent edema. Just a little bit of, like a little sac line, but not a lot of edema at all. So that looks good. You can relax. The next thing I want to do is just assess the symmetry and quality of your pulses. So the first thing I'm going to do is I'm just going to feel here for any thrill. And I'm going to assess your temporal lobe, your carotid, and then we'll assess your brachial pulses, We'll both at the same time so we can compare them. We'll do your radial pulses. Ulnar. That's for your popliteal pulses right here behind your knee. We'll assess your pedal pulses, your dorsalis pedal pulses. And then we'll assess your post-tibial pulses. Alright, very good. So the next thing I want to do is I'm going to listen to your heart sounds with the diaphragm on my stethoscope. We'll do that while you're sitting, and then I'm going to listen again with the bell of my stethoscope when you're laying down supine. So first, I'm going to listen to your aortic valve. That's at your second intercostal space on the right. This is also where I can hear your S2 sound the loudest. Now listen to your pulmonic valve at the left second intercostal space. Again, your pulmonic valve. And then this is your tricuspid valve, and this is at the fourth intercostal space on the left. Then I'm going to assess your apical pulse or your mitral valve, and that's right here at the fifth intercostal space. And this is where you can hear the S1 sound the loudest. Alright, thank you so much. I'm going to have you lay flat, and then we'll listen again with the bell of my stethoscope. Oh, here, let me get your socks out of the way. Here. Here, scoot down a little bit. Here we go. Listen to your aortic with the bell. Pulmonic. Pulmonic. Tricuspid. And mitral. Now go ahead and count your, I'm going to go ahead and get your pulse rate, your apical pulse rate. So I counted 41 beats in 30 seconds, so that would be a total of 82 beats a minute. This completes the cardiovascular portion of the health assessment. Alright, Dorothy, so now I'm going to assess your lungs, your breathing, your pulmonary system. Throughout the assessment thus far, I have taken note and just kind of watched your breathing, and you do have a regular rate and rhythm of breathing. Your breathing doesn't appear to be shallow. It doesn't seem like you're in any respiratory distress or having any shortness of breath, so that's great. Just kind of looking at your sides here, looking at your anterior, posterior, and transverse chest size. I don't see any like barrel chesting. It appears as though your lungs are like appropriate size and shape, so there's not any issues there. I'm gonna take a look. I'm gonna assess your thoracic expansion here. I'm just gonna bring that. All right. So put your hands at the capsule real angle here, and I'm gonna have you take nice deep breaths in and out. Okay, and I can adequately feel the inspiration and expiration of your lungs there. Next, I'm going to assess for fremitus, your fremitus. So I'd like you to repeat after me. 99.
99.
99.
99.
99.
99.
99.
99.
Okay, very good. Next, I'm going to auscultate or listen to your lung sounds. I'm going to start off by listening posteriorly, and then I'll listen anteriorly. So every time you feel my stethoscope, I want you to take a nice deep breath in and out. Now, you don't have to go fast or anything like that. Just do whatever's normal for you, okay? Repeat after me. 99.
99.
99.
99.
Very good. So I'm going to go ahead and listen anteriorly now. So same thing when you feel my stethoscope, nice deep breath in and out. Right here, in and out. Okay. Posteriorly, your lungs sound nice and clear. They are a little bit dim at the bases. Anteriorly, I heard a slight expiratory grunt on the upper right side. And then a little bit dim at the bases. So it's important to try to do deep breathing as often as possible. It just kind of helps open up those alveoli and create that surfactant, which makes it easier to breathe and prevents complications like atelectasis or pneumonia. And that completes my portion of the respiratory assessment.